Hello everyone. This presentation is on Cang, also called xanthium powder. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Cang belongs to the category dispel wind. A representative pattern is nasal congestion with thick discharge, reduced smell, and sinus discomfort. Important ingredients include Cang, Zinyi, Baijai, Bohi. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 37-year-old woman with chronic sinus congestion and postnasal drip. The current medicines are loratadine, pseudoephedrine as needed, aspirin 81 mg. This case gives a possible reason to consider Cang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Bohi plus oral medicines. The mechanism is that peppermint may change GI comfort and timing of some oral medicines. The clinical significance is usually low. My management plan is separate dosing from key oral medicines if stomach upset occurs. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Baijai plus aspirin. The mechanism is that Baijai has limited laboratory signals for mild antiplatelet activity, so additive bleeding cannot be fully excluded. The clinical significance is probably low, but caution is reasonable with daily aspirin. My management plan is ask about bruising or nosebleeds and avoid additional blood thinning supplements. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is pseudoephedrine overlap. The mechanism is that, although the formula is not a sympathomimetic formula, patients may still stack multiple symptom products. The clinical significance is moderate if self-treating with many OTC products. My management plan is review all OTC drugs and keep the regimen simple. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Cang may be reasonable when the patient truly matches the pattern nasal congestion with thick discharge, reduced smell, and sinus discomfort. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.